Good morning. I'm Dr. Adam Childers, and we at Powell Valley Healthcare wanted to bring you an update about all the hard work we've done to try to get ready for this COVID-19 pandemic. First, let's talk about the respiratory clinic. As many of you know, we've initiated a new respiratory clinic. The best way to access this clinic is to call and be screened over the phone, where the first level of triage will take place. If you match screening criteria, then you'll be invited to come into the respiratory clinic for further evaluation by a provider. We're going to try and time this so that you spend as little time as possible in a waiting room where you might be exposed to germs from others or expose others to your germs. So by coordinating through the phone, it will give you the safest care possible. Now please understand, while everybody would like to be tested and your physicians and other providers would love to test you, we still need to follow the criteria that are established by the CDC. We have very limited testing media available to us, which makes testing done on a as-needed basis. So those with only minor symptoms will not be tested for COVID. However, you will still receive a thorough workup to ensure that you do not have other respiratory illnesses or causes for why you're feeling sick. Next, please just remember to stay safe, continue to wash your hands, give each other a little space at the supermarkets. Remember, soap and water goes a long ways. When you're out and about in public, hand sanitizer is a great thing to use. But by using soap and water at home or where available, it will save that valued commodity of hand sanitizer, which, as we've all seen, can be difficult to get our hands on. Next, I would love to thank all the many members of Powell, Wyoming. It is truly an honor and a pleasure to be a physician here at Powell Valley Healthcare and to see the way that our community has rallied around this event. We've had people donate gowns, masks, laundry bags so that staff with dirty, exposed clothes can be bagged up and washed safely. We've had people donate food, campers lent to us for staffing to stay in if they feel that they want to protect their family by not going home at night. The community of Powell truly is a remarkable community who are living up to the standards that they have set so many times in so many other crises. Next, let's talk about some of the preparations that the hospital has done to help you. We're aware of some of the things which have taken place, such as no visitors allowed and very restricted access to see family and patients on the floor. This was done again to protect both the patients that are ill and those coming in. In addition to this, we've been following the same criteria that have been used in other places such as Billings, Seattle, and New York in preparing and establishing rooms so that if we do have cases of COVID in our community, we have the ability to safely take care of you as well as protect our staff. This protection goes beyond just keeping your germs in your room. It also keeps your neighbor's germs in your neighbor's room so that things don't get spread down the hall. In addition to this, many of the physicians, nurses, nurse practitioners, PA, radiology, and laboratory departments have spent hundreds of hours in preparing mechanisms and ways to ensure that the necessary testing and treatments will be available to everybody, no matter why they're presenting to the hospital, so that their care can be the quality of care that they expect. I want to again thank Powell Valley Healthcare for all of their efforts, and I would like to thank the community of Powell. Let's stay patient. What we're doing is working, and proportionately, the spread of COVID within our state is far slower than many others. The hard part is staying patient while we let this process continue to work. Thank you.